This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health St. Luke's Hospital. Today's weekly COVID-19 update podcast is being recorded at 8:30 a.m. on Friday, May 29th. Well, it was a 4-day week, but it certainly felt a lot longer for some reason coming back. Summer has started, and people are excited about that, and it's nice to see people back outside and returning to some degree of normalcy. I think one of the challenges, though, is going to be when do we return to normal and what does normal look like? We didn't really have definitive metrics of when we started to make changes, whether it's masking, face shields, visitor restrictions. They were done with the best intentions, but it is going to be difficult, I think, to quantitate or measure when we can start to undo some of those concerns. And as leadership and both hospital and medical staff is collaborating to come up with some sort of plan to accelerate the return to normal as safely as possible. Another interesting fact is that we started on May 6th to test asymptomatic individuals admitted to the hospital for any reason, elective surgical procedures, and all obstetrical admissions. And of interest, of 1,500 tests as of yesterday, there was only 17 positives, and 11 of those were obstetrical patients. That comes out to a percentage of roughly 1% of an asymptomatic rate, which is significantly lower than seen on the East Coast and suggested by leading organizations, including the CDC, that estimated the asymptomatic rate to be closer to 30 or 40%. Now, this means perhaps one of two things. One is that it was not as prevalent as thought. Its ability to transmit is less than what was suspected. Or the virus has attenuated as it progressed across the country and subsequently is less transmittable than it was previously, which is not unusual for a virus to do that. As we've talked on previous podcasts, that we will continue to see clusters and outbreaks, and Storm Lake is a good example of that now with a packing plant. You know, I inquired as why packing plants? What is the anomaly there? I've come to two conclusions. One is it was one of the industries that continued to operate while others were shut down, so that isolated it, the packing industry. I heard on the radio yesterday there were 600,000 hogs behind production. So there's 600,000 hogs waiting to be processed, which is just an astronomical number if you ask me. The second is that they do work shoulder to shoulder in these plants, and it's also very loud. So people are screaming at each other to hear, and that may increase the transmission. Many of these packing plants, whether they're Hispanic or from Central America or from Eastern Europe, Bosnia, Croatia, or Southeast Asia, the employees tend to live in extended families in close quarters, therefore increasing transmission. I think those are all the elements that contribute to that, and we'll continue to see those spikes. But as I've said before, we can handle that, and by we, I mean the healthcare system in the state, regardless of affiliate or city. Resources moved to Storm Lake Thursday evening to accommodate the spike they were seeing, and it is reported this morning on May 29th that things are stabilized. But it reinforces that we continue to need to practice the 3 C's of cover your cough and sneeze, clean your hands and surfaces frequently, and contain yourself if you're ill. Wearing a mask is appropriate, but wearing a mask simply alone is like putting a chain link fence around your yard to keep the mosquitoes out. It's not going to work by itself. It's going to take those other elements of that. We know what we do and we know how we do it. It's times like these we learn the why. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unipoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.